call me Cuba Pete. I'm the king of the rumba beat. When I play the maracas, I go chick, chicky, boom, chick, chicky, boom. Hey!
Good evening, and welcome to the Cuba Pete Show. We are so excited about this incredible collaboration between the Neighborhood Health Series and Cuba Pete tonight. I'd like to introduce you to my friend Craig Fraley from Clark County Credit Union. Clark County Credit Union has been a proud sponsor of the Neighborhood Health Series for more than 6 years. As this incredible community sponsor, Craig's donations go to support the series as well as go to contribute to student scholarships. With that, I'd like to turn it over to Craig.
Thank you, Vanessa. As the medical-filled credit union, we're very proud to help sponsor Roseman's Neighborhood Health Series. If you have an allergic reaction to banks, we're the cure. We started in 1951. We're owned by our members. We are not for profit, which means we give our profits back to our members. Since the year 2000, our members have received back over $68 million. Please visit us at ccculv.org or give us a call at 702-228-2228. I hope everybody has a wonderful evening and enjoy the show.
Well, for the first time I can say live from Studio A in Las Vegas, I'm Pedro Joe Greer. I am the Dean at the Roseman University College of Medicine, and welcome to Cuba Pete No Laughing Matter. Generally what we have are guests to see the intersection between what happens in society and how that affects health and how that should affect the education of our future workforce. Today we have those that are actually going to be putting this whole thing together and running it. This is an incredibly talented group, an incredibly diverse group, not just in gender and ethnicity, but also in their terminal degrees and what they do and what they have done. I mean, it's a wonderful group to be considered part of. So we came out here to Vegas to start a medical school, to change the way medical education is, to improve the disparities that occur in our communities, which has been so exploited and seen through COVID, to diversify our own profession, to develop new systems, not just new systems of delivery of care, but how we teach and how we prepare the future workforce. Our profession has, and is now acknowledging it, had a problem with diversity, to say the very least. I mean, to put it bluntly, if you look at it systemically, we are racist, sexist, xenophobic, elitist. We've lost many of the attributes and virtues that we need in our profession. Maybe they were never there as well as they should be, but we're going to go for it, like humility and empathy, compassion, social accountability. And as we introduce what we're doing here, you're going to see how we're fitting all that into education and how we want to make it so that Vegas, what happens here, the world comes to see because it's the right way to do it. I'd like to start, first of all, I want to just introduce everybody here. I have Dr. Luther Brewster back there. I have Dr. Marin Gillis, Dr. Cheryl Brewster, Dr. Karin Esposito, and Christina Conley. This is the senior executive team that we have. They are all going to have different roles in what we do in forming this and putting this together. So I'm going to start off with, how are we going to diversify our medical school? Well, first of all, you have to start off with diverse leadership, which I think we have. But then we have to have diverse student bodies. And that is being led by Dr. Cheryl Brewster. Let me just tell you a little bit about her because she is so impressive. At our prior institution, she not only won the Presidential Award on Diversity, she had over a $2 million grant to bring in students from historically black universities and colleges to be able to go into medical school or health professions. That was one of the most successful programs. She has her doctorate in education from Teachers College at Columbia, New York. She has her master's from Clark Atlanta University in Atlanta, her bachelor's from the University of Maryland. She was a Kellogg Scholar, a postdoc at the University of Michigan School of Public Health with a fellowship in community-based participatory research. And then she spent a year in London at the University of East London, where she did coursework on gender, sexuality, ethnic studies, and examining the interface and intersection of social divisions. She has had leadership positions nationally and internationally. She was with the AAMC Group on Diversity and Inclusion. And it is with great pride. Oh, besides that, she's got a son that grows an inch every 7 hours. He is now.
That would make him 7 feet 11. By the time we finish.
Well, the next Kareem Abdul-Jabbar.
There we go.
With that, I have the pleasure of introducing our Senior Executive Dean for Diversity, Equity, and Inclusion. That's you.
That would be me.
Sir.
What your title is only part of what you do.
It's only part of what I do.
Because the other thing that you do that is so fascinating is your pathway program. A rose grows in the desert.
So that's just one of them, right? So we have Aspire, which is a tiered pathway program. So we have to hit the problem, address the problem at multiple levels from multiple directions. And we need to address the shortage of diverse physicians or just healthcare providers in general by starting at an earlier age. And so the tiered approach is working with K through 12. And so you're actually creating programming that is age appropriate by introducing them, in many cases, just the idea of a career in health. And then as you get into the undergraduate level, you're talking about students that have an idea or think they have an idea, but don't understand all the ins and outs of what it takes to actually be a physician or a healthcare provider in general. And so you have to spend more very specific time around specific things that they need to do to prepare for their journey into medical school. And so we have to break that up. And so we start K through 5, so 5th grade. Then we have 6 through 12. And then we hit from undergrads all the way up through, I have master's students that I've worked with that are trying to get into medical school. So every level has a different approach. But we do have one that is just very broad and general, and that is A Rose Grows in the Desert. This is an opportunity, it's sort of a teaser. It's a showcase of community partners. It's a showcase of a community in general, of all the resources that are available, many times in communities that people think are underserved and under-resourced. And data shows that it is underserved and under-resourced, but people don't even know what resources are actually available in their community. So A Rose Grows in the Desert brings together community partners in specific areas in and around Las Vegas. And these community partners are healthcare workers. Some of them are at organizations that provide science, technology, engineering, math opportunities for young people. So we bring everybody together for a few hours on a Saturday every quarter. Our next one is November 13th, and we're going to be in the historic West Side. And so we have pretty much about 15 to 16 partners that are going to do live demonstrations, and the young people are going to, engage in these activities throughout the course of the 2 hours that they're there. And so one of the things that we've learned is that mental health is something that needs to be addressed with this population. So we've actually incorporated some activities around mental health and wellness. So we have someone that is going to work with the students around music therapy. We have someone that's going to do Reiki. We have someone that is going to do trauma-informed yoga with the students. And so we're trying to work with students where they are. So we understand that they have needs that might not be addressed. And if those needs don't get addressed, we can't even expect them to earn the A's or B's that they need to in school in order to be successful to move through, elementary school, middle school, high school, and subsequently college to get into med school. So addressing these mental health needs that they might have is one area of how we work with young people. And then providing them with the STEAM activities is another part of the activities that we do with them. So it's a dual approach, addressing the psychosocial issues that these students often have, as well as the academic issues or addressing academic deficiencies that they might have. And then also just creating awareness and curiosity around the STEAM field.
And Cheryl, when we go into these communities, we're actually looking and targeting first-generation college kids, which also brings in another issue that you also address, is that of the parents.
Right, and so we do at each of the events have a parents' corner where we are set up with different resources that parents can actually access and have conversations with people from the different organizations that do provide these resources. And we've had feedback, we've had a parent reach out and say, oh, you had a resource at your last event. Can I get the information for that resource? And it was around mental health. So we do definitely provide resources to the parents, the young people. We understand that a lot of times there's a lot of pressure on first generation students. And parents, sometimes because they haven't gone through that journey, aren't aware of everything that it takes to go on that journey. And we have to inform and we have to educate and let them know what this journey is going to be for them as well as the young person actually on that journey. So educating both parties is vital for us to be successful in getting students into medical school. And the other part of that is also making sure that our faculty is diverse. So students want to come in and they want to see people that look like them or have similarities to them. And so it all kind of ties in. You can't attract a diverse student body if your faculty isn't equally as diverse or they feel like they don't have a sense of belonging. So we want to make sure that we're creating that environment, that learning and working environment for faculty, staff, and students that is one that everyone feels a sense of community or a sense of belonging. So it's kind of an all-encompassing job that I have.
And not only that,
a very powerful job.
No, that I know. That I know. I'm not arguing that point at all. May I ask another question?
Yes.
Thank you. Is that at our prior institution, we had 50 to 55% of our student bodies were underrepresented minorities. The statistics around the United States, these are American medical colleges, are 5% of American medical students are African American, 5.7 or 5.8% are Hispanic. A much smaller percentage of those are even in leadership roles in academic medicine or in other aspects of medicine. For example, 10 to 12% of leadership roles in medicine are women. Almost half of the profession are women. So it's not just a matter of diversifying, but the inclusion and the equity to allow people to not just feel part of it, but also ascend in their respective organizations. And if you look at the editors of major journals in this country, there's only one African American, no Hispanic, who is a major editor. As you go down the line, associate, assistant editors, you will have a little bit more diversity. But one of the other reasons that we do this and we want to target is twofold. Number one, empiric evidence from our prior institution told us that those that were first generation college tend to come home. They go to the best places to train. They go to UCLA, USC, they were out at University of Texas, in Houston, in cardiology. They have been at Johns Hopkins. But you know what? That first generation college student will be the very first one in their family to have the ability to earn wealth, which means they can own a home, they could pay for their kids' education, and that continues. My own family, my father's the first one in our family to finish high school, much less go to college and become a doctor. And he was able to see his granddaughter graduate from Harvard Law School. Of course, she went into public interest law, so I can still support her. But she does really good stuff. So what we're trying to say is, let's not throw away this talent that this country has. Let's make sure they have all the infrastructure and support they need, as Cheryl is talking about, to be able to be successful in their professional careers. And coming from these communities, they understand exactly what happens. We as physicians need to have social accountability. Mental health, an issue that Cheryl brought up, is a major problem in this country, regardless of socioeconomics. However, we don't address it properly. We don't have the infrastructure for it. Substance abuse. We're not doing that too well either, nor are we including it in a lot of curriculums in medicine except for add-ons. So when you have all these problems that exist out there in a country with these disparities and people not being able to get to a physician, COVID. Telemedicine was originally conceptualized for rural or poor communities. Well, when COVID hit, those were the two that didn't get telemedicine. And they didn't get telemedicine because they didn't have a provider to be able to talk to them, to answer questions. So they're left out of telemedicine, which telemedicine is also showing some effectiveness in the mental health area. So it's important that we address these things. And how do we address these things? Well, that comes Dr. Luther Brewster. Lou and I have known each other since he had hair and mine was black.
Or he's black and your hair's white? I don't know.
No. No, my hair was black.
Oh, okay.
It was, I swear to God.
I believe
I'll show
you.
you
We've seen
I believe
pictures.
I've seen you. You were like 20.
Yeah, I started graying at 22. Lou came to us actually from being a founding faculty at the Florida International University School of Public Health, where before that he was at the University of Michigan. He did his postdocs at Queen Mary University in London in urban renewal and health impact assessment. He has his PhD from the University of Georgia, who, by the way, are ranked #1 now in the football polls. And
That's right.
Oof.
I
Very
played
true.
with the
Very
Gators.
true. Just recently beat University of Florida. Yes, we did.
You haven't played us yet. Wait, it's a big game. Where he got his PhD in health promotion and behavior. He has a master's in nutrition from Georgia State University and a bachelor's in biology. He was pre-med at Morehouse and decided maybe he's got a better approach to make our society healthier. He has been named by Legacy Magazine top black educator and health professional. He's a German Marshall Fund Fellow from 2010. He's a fellow. He did a faculty fellowship in policy analysis in the summer at the RAND Corporation, the largest and most prestigious think tank in this country, as well as having been a lecturer there and invited back to teach the students there in policy analysis. And he's a top scholar named at FIU. He
That's enough.
no, there's
We
one.
get it. Right? We get it.
He's worked in the private sector in Harlem and in London with the Arsenal Football Club, Emirates Stadium Housing Regeneration Project. Boy, but the Brits make a long title.
Yes, that's part of the degree. It comes with the degree.
And Lou is also the architect of what we refer to as household-centered care. Household-centered care is being able to take care of the household in its entirety at their home by identifying and mitigating the social determinants of health, which are 80 to 90%, depending on what literature you read, as a cause of disease and exacerbations of disease. It also allows families that might not have insurance or are undocumented that are working 2 and 3 jobs, that if they take one day off to go see a doctor, guess what? That's 20% less they make, plus whatever they're charged. And if they don't have daycare, they got to schlep the kids along with them, and they got to pay for all that transportation too. It's a cascade of problems. The poorer you are in this country, the more complex your life becomes. And it becomes essential that we work with communities. We become dependent on communities, not going into communities and thinking that we're the knight in white shining armor that's going to save them. We're there to work with communities, to learn from them, and to make them better. And Lou here in Las Vegas, and we're about to launch, has a household-centered care model entitled Genesis. And Lou, why do you think this is important? A, developing systems like this for society, but B, most importantly, as an educator, to immerse students in this?
I guess I would go back to the statement you made about we're throwing away talent. One of the reasons, there's more than one way that we are throwing away talent. Yes, we're not allowing them access and we're not including them, but also once we do include them, we put them in structures that beat the idealism out of them. And so, most of us go into a particular field with a ideal in mind of what it is that we hope to accomplish. Many physicians, when they're younger, want to, cure the sick and be good stewards to society from that standpoint. And then the system, whether it be my field, public health, by the time you're in it for several years, you become disenchanted by what you really can do because the system has become so driven by success over solutions. And so, yeah, you may successfully implement your vaccine protocol, but no one is getting better. Or you are able to enroll people in a particular insurance plan, but no one's going to see the doctor. It's success over solutions. And so what we hope to do with programs like Genesis is to, one, inspire the students and the faculty who are working within it that there's a vehicle, there's a way for them to actually have a meaningful impact in communities, that they really can regain the trust of communities and do some of the ambitious things that they wanted to do when they first decided that that was their chosen profession.
And let's just go to trust for a second. Without the trust of the community, we get into problems like vaccine hesitancy, misinformation, and having people come down and talk down to you, which has been one of the problems.
Yeah, well, so built into the title of the work I'm charged to do is innovation. And innovation, its most important precursor is trust. Rarely will a person adopt a new innovation if they don't trust those who are implementing it. And so you're only as innovative as you can create trust. And so we're at a time right now where we are desperate for innovation in all areas, beyond just healthcare and medicine. And we are limited, sadly, because we have so little trust. And that trust has been eroded by so many different things. We could probably spend all day talking just about that. But we as the collective, have chosen to focus more on how do we restore it as opposed to how it actually was eroded. And so one of those solutions, obviously, is building a radically different medical school, one that is rooted in the community, one that will be charged by its values and hold each other accountable to those values at all levels of our leadership. And so and from the standpoint of what we plan to do in the community, the overall overarching goal is to, yes, have Genesis and perform home visits in medically underserved communities and provide them with dual medical and social service support, coordinate that service with our Roseman Medical Group, our primary care practice, but also then train students in that model, not just medical students, but nursing students, pharmacy students, dental students, which is the calling card and the strength of Roseman University. And then hopefully translate new information, new knowledge on how those different fields collide and provide effective healthcare outcomes and health outcomes. And so blending all of those things together, seeing to it that we are having a representative voice in everything that we do. So not just simply going and doing this work on or downward on a community, but actually including the community in the work that we're doing, not only from the standpoint of the traditional doing research with the community, but including them in things like procurement, where we buy, where we shop. All these things are very important in building trust, because it's very difficult to get an individual to do something for you when you've never done anything for them without an expectation of anything in return. And so that's where we will be different. And I think that's the beauty and kind of the joy of doing this work.
You said a couple of things. One I want to touch on was you mentioned the word vehicle, so I want to talk about the cars.
Okay.
And number one. And number two.
The new cars we just got today?
Yes. Well,
and number two, innovation and technology. Mm-hmm. When you talk about technology, people don't think about utilizing that appropriately to aid and be able to expand, and particularly in very vulnerable communities. I'd like you to talk about the platform that you've been working on that we're going to be using here.
Yeah, so technology all over the world has been an incredible tool for leapfrogging some of the deficits in low-income or marginalized communities all over the world, whether it be jumping over landlines to broadband systems in Africa, any number of other examples. And so we're no different here. We believe that if you can develop a certain level of trust with the community, that being able to introduce technology that is driven by them and not us just kind of technology assisting them, but actually doing things that allow them to enter their own information, own their own information, which is another shortcoming of technology, is It's all about collecting your data and selling it to the next person to make your next million. But that's not the goal here. The goal here is for you to actually borrow or partner in the use of their data, and they always retain the ownership of it. But the platform you're talking about on the Genesis operating system is about the ability to longitudinally track the social determinants of health, or the social, cultural, and economic factors in people's lives, and see how that is either supporting or inhibiting their ability to achieve their health goals. And so, to the extent that we are able to educate them while simultaneously having them play a large part in entering that information, is where we'll gain real success. It's where we'll be able to help even more households and families as a result of them helping and engaging us in this process of trying to help. And then as time moves forward, who knows, maybe we can create a phenomenon where the consumer becomes the provider, right? Where they can begin to help their neighbor, or help a medical student to learn a particular topic that, related to the social terms of health. And so there's just tremendous opportunity when you use technology in a responsible and ethical way. Yeah, there you go, right? There's a lead in for Dr. Gillis, right?
And along with that, my profession, and particularly my generation, perhaps the generation that followed me, are very fearful of analytics in medicine. And so by introducing the student to analytics at the very beginning and how it can optimize the care of a patient, means we also have to train the students differently. No longer is it that it all has to be in your mind to make a diagnosis. Now you're going to have evidence-based studies. Now you're going to have algorithms, and you have to train a physician to be able to differentiate if somebody is an outlier from those algorithms. How to communicate, because all this information is going to be right there on the screen. To communicate that to your patient, to be able to appropriately treat that patient and do it together with the patient. By the same token, we got to get physicians to start listening better.
Yeah, but also there has to be their ability to also apply their critical thinking to technology and innovation also, right?
Yeah, 100%.
And be very, very shrewd in their ethical consideration of the technologies that are coming online. If individuals are not, if they're using an algorithm that's already biased, if you're using, or if individuals are opening up access to data that is already biased against one group over another, then the students, if they just kind of follow the outcomes or the recommendations posed by that algorithm, then we end up with the same system that we currently have, but even worse. Yeah, it becomes indoctrinated even further, and we call it science. So now we have a risk of making bias and racism and discrimination scientific.
Which it has.
Which it has.
Which is a true but very sad comment. And there you have it from our Senior Executive Dean for Community Health Innovations, Dr. Luther Brewster. By the way, if anybody has questions, you could put them in the chat room and just list the questions, and at the end of the show, we'll be answering these questions. You had mentioned ethics. I think ethics is the core of what we do, and something very, very important. Our Senior Executive Dean for Faculty Affairs and Learning Innovations is a philosopher, a bioethicist, and an award-winning medical educator. She is internationally recognized. She's actually international. She came from Canada.
I was waiting for it. I was waiting for it.
It's a foreign country.
I was like, I wanted to see how long.
Who was actually at the University of Nevada, Reno, prior to coming to our institution in South Florida and then coming back here. She is she's a director of the USA Working Group and director of the International Academic Affairs for the Cambridge Consortium for Bioethics Education. She is the co-founder of the Ethics and Humanities Education in the Health Profession Affinity Group at the American Society of Bioethics and Humanities, which she co-chaired from 2013 to 2020. She's a Macy Harvard Scholar. She served for 3 years on the steering committee for the AAMC, that's the American Association of Medical Colleges, group on women in medicine and science. And it is with great pride that I introduce somebody that is not only an incredible educator, having put together hackathons and studio design teaching, because as you listen to what we're saying, the world out there is a lot more complex than the disease of an organ. And unless we can understand and put all these things together, we're not going to produce the future workforce we need to improve the health of this nation. With that, I have great pride in introducing Dr. Marin Gillis.
Thank you, Dr. Joe. So I have a number of hats, and I'm first going to talk to you about what we're doing in my office for faculty development. Because as we're talking about having a brand new approach to medical education, as you've been learning about, and we're trying to recruit first gen, we have, and we're a community embedded medical school, we're going to have to rely on clinical educators who have not been trained in this new way.
And what she's saying is very few doctors have been trained in how to teach.
Well, there's how to teach, but how to teach properly. How we teach.
Yes.
Right? So, or what we want to have taught.
The old saying in medicine was, see one, do one, teach one.
No, but one of the, when I speak about what it is that I do and why something like faculty affairs is at the level of the development of a new medical school like this, is because unless you prepare the educators in this way, they're just going to be perpetuating everything, and they're going to be confused. And so we're going to have things in the classroom, and then they're going to be in clinic and not understand, what's going on. So we're going to be relying on a lot of educators, like physician educators in our community, and my job is to help them understand things like social determinants of health, like understand the kinds of things that we're going to be doing, what household-centered care is. And one of the reasons why it's exciting to be at Roseman is because Roseman University of Health Sciences cares about innovative education. And so of the things that my office is going to do is to prepare all of our faculty with the Roseman 6-point mastery learning model. We're also going to get our faculty to be what we're calling Genesis ready, so that when we do Genesis in community, our faculty are going to be prepared for it. And that's a very exciting thing. So the first thing my office is doing is that we're putting together a clinical faculty newsletter, which is going to address educator development per se, so just basics in education, like how to develop a curriculum, how to give feedback. But we're also going to be including social justice topics. So for example, we've got lots of information on how, let's say, recommendation letters for students going into graduate school or health professions education are written, and the bias that's included with that. So we're going to give how-tos on how not to do that, right? So to have respectful, fair letters so that these students have the same chance as anybody else to get into these professions. So we're going to be developing clinical faculty with regard to education, with regard to social justice issues, and to prepare them for our innovative curriculum.
And talking about social justice, we talked about the pathway of bringing students in, but a pathway doesn't just stop when you get to medical school. It continues afterwards. And you have plans for that also, don't you?
Oh, absolutely. One of the other things, because at our previous institution we were so successful in what we did, we have a number of our former graduates who are now just starting careers in medicine themselves, and they're all over the country, and they're asking what we're doing because they've been following us, because they were introduced to us and they believed in us, and now they're out in the world and they've said anything we can do. So we've decided that we're going to start a fellowship program to train them to be educators. And so by the time they're finished that, they can be mentors to our new students.
Excellent.
And they will educate the way we want.
The best way, the Roseman way.
We're going to have a new indoctrination.
The Roseman way.
And the beauty of all of this being at Roseman is when you are out there and you're meeting a child that perhaps wants to be a physician and in their first generation college, we're giving them options. Mm-hmm. They can go to dental school, they can go to medical school, they can go to pharmacy school, they can go to nursing school or graduate nursing.
That's what's exciting about this, because when we're going to be doing interprofessional education, in the programs themselves, that's a mirror of what the real world is like.
It's 100%. 100%. Well, thank you very much. To put all these together, we have our Senior Executive Dean for Academic and Student Affairs. It is with great pride that I introduce a another foreign-born. This one from Germany, and also first-generation college. What is so impressive about Karin Esposito, first of all, this is the only medical school in the country where you have a Cuban named Greer and a German named Esposito. But Karin has an MD, a PhD. She was Phi Beta Kappa as an undergraduate, AOA, which is a similar honor society in medical school. She's one of the most accomplished academicians and administrators I have met. Her intellect, as well as her passion, and besides all that, she's also a very accomplished classical musician. And I'm not going to mention that you climbed the Alps with your dad.
I didn't think you weren't. I didn't. We had a bet. We had a bet for that.
I didn't. I said I'm not going to do it.
He's not going to say it.
Not going to mention it at all.
Perfect.
Prior to her coming here to Roseman, she was with us in South Florida, where she was the Executive Associate Dean for Student Affairs, a Professor of Psychiatry and Behavioral Health, Associate Dean for Curriculum and Medical Education, and the Associate Dean for Academic Affairs for Women in Medicine and in Science. As well as all that, she put together and launched the very first psychiatric program at an FQHC that's primarily outpatient, to really deal with the problems that are occurring there. The very first and one of the most successful right now. She had, prior to coming to FIU, she was a professor at the University of Miami, and she was also at Jackson Health System, which is one of the largest health systems and the largest public health systems in this country, where she was the Associate Chief for Medical Officer for the Mental Health and Chief of Service for Ambulatory Service and Correction Health at Jackson Health System, covering over 200 facilities and primary care clinics within the Jackson system. Karin comes in with deep passion, with quite an opinion. And
I think that's probably true of everybody's.
It is everybody here.
I was saying, she's not the only one. It's kind of, there's a theme here.
I think there is. I think you're a brave man.
Oh, I'm a liver specialist too, which doesn't help. But it is with great pride that Karin, who is leading our whole curriculum, as well as what the importance is of taking care of the students and the wellness when we're there. What are your plans for Roseman?
Well, thanks, Joe. And to all of my colleagues, right, who are all opinionated, don't. But I think that as I'm sitting here listening to everybody, one of the most wonderful things about coming out here to do this with this group of people is how mission-driven we all are and how we are all on the same page. And as we're doing our planning and as we are, discussing various programs and various launches, yes, we don't always have the same opinion, but we know we're all doing it for the same reason, right? Which is to benefit our patients, to benefit the community, to educate our medical students in the best possible way. The bad news I have for you guys is that medical school is 4 years long. It's still 4 years long. So we still have to do all this new stuff in 4 years. And it's an interesting challenge in putting together a curriculum that you want to have novel elements. And yet, of course, the main goal is to provide excellent physicians who are well-trained to provide great clinical care, who are ready to go into any residency program in the country, whether they're going to be family physicians or psychiatrists or liver specialists or surgeons or ophthalmologists or whatever they want to be. So one of the ways that we're doing this is to really work on developing a highly integrated curriculum. We already have a fabulous curriculum planning committee going with representation from the other Roseman schools, from dental, from nursing, from pharmacy, with some wonderful clinicians from the community who have some academic backgrounds and who are participating with their input and ideas as well. So how are we going to integrate all this? Because we have to teach biochemistry, We have to teach biochemistry. We have to teach all the medical specialties, expose the students to obstetrics and gynecology, to pediatrics, to internal medicine, et cetera. The great opportunity that a program like Genesis gives us, or a model like Genesis for providing care to the community, and it allows us to integrate our students and really give them a longitudinal view of patient care. which is not an experience that a lot of medical students get. There's a lot of rotating in medical school. You spend 6 weeks here, 4 weeks there, et cetera, and that's critical for them to get exposed to everything and learn everything. But the ability to work with a household and really learn early on what our patients are dealing with. Right, it's not that simple. You go to a doctor, or you as a physician, you have a patient come to you. You make a plan, you write a prescription, and if you don't know how difficult it's going to be for that person to really implement that care plan, then you're not really providing patient-centered care. You're not really using shared decision-making and all of these other sort of buzzwords that we have around, really aligning with the patient and making a treatment plan. When our students go into the homes in interprofessional teams is a wonderful way to do that. They can really see what our patients are dealing with.
And also by the fact, just by socioeconomic levels, even
Absolutely.
if you have different socioeconomic levels with the same disease, it's very, very different.
Absolutely.
The households we're going to go in, a diabetic there is not the same as a diabetic that's the CEO of a company.
That's correct, right? That being said, everybody has impacts on their health care and things that they're dealing with, particularly when you get into mental health issues or substance use issues. And so really getting that perspective, one of the neat things that we want to have the opportunity to do here as well is to have our students manage groups of households as teams so that they're really getting a team management concept at the same time as a practice. Like, how do you actually manage a practice? How do you look at data, right? How do we actually see, how things are progressing? The other sort of half of my job, which is in student affairs, is also to pay attention to the well-being of our learners. There is a lot of burnout in the medical profession. Lou was talking about, people come in very idealistic. Thank you very much. See, that's perfect. Thank you. People come in very idealistic. They've written all these wonderful statements on their admissions profiles, personal statements about how they want to be a doctor and they want to help people. And sometimes that idealism does get impacted through medical school, residency, future practice. And some of that is this struggle of how a doctor is positioned in taking care of patients. And so paying attention to students' wellness, really having a student-oriented approach to the curriculum so that we understand their experience and provide them with the support that they need to get through. It's a difficult course of study. It's not easy.
But that's more of an American phenomenon with the students. And one of the things that we see in this country is after the third year of medical school, empathy drops off.
There are some data that support that, yes.
And at least in the Journal of Oncology, it was not an old study, but not a recent study, where it showed that patients only perceived empathy in 1 in every 5 visits. Yeah. And so one of the things that we saw at our prior institution that we're seeing here is by embedding students in the community, you change that power differential. No longer are they coming to the ivory tower, you're going into their home. This increases their empathy and this increases their humility, which I think is something really, really important. And it makes them better understanding. And as Karin pointed out, no other medical school is showing them a longitudinal 4 years of following a patient or a household, and seeing all those interactions and all the different things that happen in lives that they aren't familiar with, in worlds that they're not familiar with. The other thing, Karin, is as we're putting this together, you've already gotten us on some AMA committees.
Yes.
As a medical school that hasn't even opened yet.
Yeah, so the American Medical Association a number of years back created an initiative called Accelerating Change in Medical Education. And at our prior institution, we were one of the consortium schools. It's about 37 schools. And one of the things that I wanted to do when coming here was stay a part of the evolving conversation of what are the best practices in medical education? What are people thinking? What are other schools sometimes struggling to do? Because it's very hard sometimes to change a curriculum. You might have some really great ideas, but changing something is difficult. And I want to benefit from the best ideas of our colleagues, in designing a curriculum. And so actually, Dr. Gillis and I were just on a call this afternoon about student wellness. And earlier this week, I was in a 2-day workshop on health system science curriculum. And so I really appreciate them allowing us to take apart and understand that as a developing school, we may be able to implement some things that are on everybody's mind as, this is something that we really need to do. So appreciate being part of that conversation.
Well, I mean, I think collectively the reputation of this group, of each individual as well as collectively, has opened many doors for us and things that have never been done. One of them is your representation with the AMA. The other one is the Arnold P. Gold Foundation, which has the Gold Humanism Award. Well, schools are not allowed to enter into that until they've graduated their first class. They've already allowed us that once we start with our first class, we can begin that process, which is something that, Marin, you really championed. And you took it through the roof. And guess what? You're doing that again.
Exactly. And that's another hat. But that's a lot of people might know or have heard of the white coat ceremony. And it was the Arnold P. Gold Foundation who brought that back, and has also started it in nursing now too.
It's exactly right. It's exactly right. So, what you're seeing here is representation at an international, national level that really want to be able to do something really spectacular. Las Vegas is a wonderful community, a community that we are a part of. We are not just embedded in the community, we want to be dependent on the community. We want to make our community healthier. We want to produce the physicians, the nurses, the dentists, the pharmacists that come from here, that stay here, that see this as a future. And to say we're excited is not an easy thing. So now you have us and a few other people, and who herds these cats? Who tries and control all of this?
Cha-ching!
Cha-ching!
Purse strings.
Well, we have Christina Conley, who has been just unbelievable. Interestingly, she's from Florida too. But that she came out here like 11, 12 years ago.
In anticipation of us.
Exactly. Prepare.
It's dry here.
She's our senior executive dean for finance and administration. So anybody administratively, anything financial, she runs. But she doesn't just run the medical school. She's also got Genesis. She's also got Roseman Medical Group. We didn't even talk about Empower. Empower is a new service that we're offering, run by and designed by Andrea Peterson. And what it does, and once again, being socially accountable, it's a program to offer services for women that are pregnant with an addiction. And not only that, following up with the newborn. So as you can see, we're already in the community with both the Pathway, we'll be at the beginning of the year, with Genesis and with Empower. So you have all these different pots of money that's come from all over the place, administrators. We are all the way from South Jordan to Las Vegas, and that's under her control. And Christina, first of all, it's been a pleasure working with you, and you have done a spectacular job. And by the way, she's got the two cutest girls in the world. One of who we turned on to oatmeal cookies. Okay.
I've been baking them ever since.
So,
Because that's what you want, a child with more sugar.
That's exactly.
That's right.
And so, Christina,
Joe.
how do you see us in the future, and how do you see us now?
Rich?
A lot of money, a lot of zeros. We'll get a lot of zeros.
Yeah. She having said that, those that are listening, we are going to need money for scholarships and to start the school, so please feel free to send money.
Enter it in the chat.
Enter in the chat.
Venmo, Cash App, all of that.
Pledges in the chat.
Sitting here, one, I'm honored, and I kind of think back to, a couple years ago when you came out and did the presentation at the Breakthrough Building on social determinants of health, and I remember sitting there and like, wow, this is pretty cool, right? And next thing you know, I hear that the new dean's hired, and I was like, oh wow, that's I'm excited.
then I hear these people are following him out here.
Who are those crazy people?
I was like, they haven't seen this yet. Okay, wow. Okay, this Joe guy must be,
No, I promised them beachfront.
God.
I didn't say there'd be an
No
ocean.
water.
I said
Okay.
there'd be beachfront.
Lots of sand.
And so I'm sitting back thinking to myself, like, wow, okay, I'm excited. And now, a year in, I can see why they followed. And why you guys are out here. And I mean, to be able to sit on the couches and in the offices with you guys and support and help all the programs that are going on. I mean, I think it's fantastic. I think the community needs it. It's been a fantastic year. In the future, I'm going to need more staff.
Yes, you are. You are.
Yes, you are.
Yes, you
we
are.
are just getting started.
We warned you.
That's right.
You will need more staff.
But
That is true.
The importance of Christina's leadership, administratively, financially, and what we do, is the core of what we do. I have no background in finances. As a matter of fact, I have 2 children, so I have no finances. But the reality is, without Christina doing what she's doing, we can't create new things here. And by the way, she's also involved in the creation of these things, as her opinion is so highly respected. But you are the backbone of any type of organization that works. And I had no problem deferring all that to you, very simply because of your talent.
Well, I appreciate that.
And
It's a lot to live up to.
what?
I said it's a lot to live up to.
We have a high
Still around. I
bar.
We have a high bar.
My
We have
back
a
still
high
works.
bar.
We're okay.
Well, you guys, we're coming towards an hour already.
Who knew?
Who would have known?
That's why our days go
So what
so
I'd like to
fast.
do now is we'll stay in conversation, but if anybody has questions in the chat room, who's going to be reading the questions? Shayla, you are? Okay, perfect. Do you have any questions? Make one up. Our football team is still undefeated.
That's true.
Ba-dum-bum.
Well, so you introduced everybody, but nobody introduced you.
All right,
so
let's
we-
go.
No,
Let's
so
do
we
it.
each get to give
we
one
each
point.
pick one thing.
Right? We get one point,
like
right?
it.
So mine is, shamelessly, I will begin. I'll try to keep it to one run-on sentence point. Joe, yes, is the reason we came out here. And I think we could all say, Joe is probably one of the most straightforward, straight shooter, honest individuals you're going to meet. He's just not going to be swayed off of his point. If he believes in something, he believes in it till the end. And that is probably one of the reasons why it's so easy to have faith in him. He sadly went to the University of Florida. That happens. That happens. We can't hold that against him at all. But he survived it, and he was smart enough to find somebody from the University of Georgia to put himself close to redeem himself. And he's admitted that, and I have a document that I can send to the University of Florida in proof of that. But that would be my thing. I just think that, that's one of the reasons why. Okay.
Well, thank you, Lou. And
Whoa.
No, you don't get to speak yet. Go,
Dr.
Marin.
Gillis?
I think that you have the most incredible sense of integrity. I think that you say what you mean what you say, and I trust you.
thank you.
And I am so honored that you invited me to come out with this team.
Well, this team wouldn't have been complete without you.
Well, thank you very much.
So I'm powerful.
Yes, I know.
I can feel it. I can
There's
feel
a
it.
but.
But
Emanates.
like you are the bomb.com. Like, so all jokes aside, there's not many people I will follow blindly out west.
Hey, the West is the best.
To
West
a
is the
place
best.
where I never even thought that I would imagine I would end up. But I believed in your vision. I believed in what you wanted to see happen. I believed that we as a team, I came because of you, but I also came because of my colleagues, because you picked the brightest and the best. Because that's what we are. What did I tell you? You have to claim it. So I believe in you as a person, as a leader. So that is why I came. And I thought we were telling good things like the paper orders and the MacArthur Genius Awards. We're not doing that?
Well, there's three people who have both a MacArthur Genius Award and a Presidential Medal of Freedom. And Joe is one of them.
Joe is one of them.
But Joe called me one day and told me that is not true.
There's another one?
No, there's only two, because he bumped off one of them. And so I think this time next year, mysteriously, there will only be one.
Okay. I think I'm going to take that integrity question.
He did it in a highly ethical way.
Okay. There was no suffering?
Yes.
I'm passing the torch, Dr. Esposito.
All right, well, you guys have covered a lot, but I would like to add how inspirational I've seen that you are for our students and for learners, right? Because that spark that we're talking about that sends people into medicine and that makes them want to do the right thing for their patients is something that you've never lost. And I hear it in how you talk about your patients now. So I think that's a wonderful thing. You understand the importance of teaching communication skills, of really teaching our students what they need to do to interact with a patient in a respectful and way and an honest way. And so that's a great example to set for the school. Mm-hmm.
You have really good coffee in your office.
He does. Really good coffee.
I forgot about that.
Does have really good coffee.
Good
You should have started with her. I was like, I don't know how I'm going to end this one, but I think you did it well.
One.
I think
that's
you did it
that's
well.
the best one.
That's a good one.
We followed him for the coffee.
That's right.
And there's a second wave, too.
Yes.
Of folks coming out for you.
There's a second wave. Mm-hmm.
As you can see, you have one of the most passionate, intellectual, hardworking, mission-driven educators that this world has ever seen. It is a great honor of mine to be considered a colleague of theirs. And what we want to do here is really make a difference. Make a difference in improving the health of the community, making a difference in increasing the number of healthcare providers here, diversifying what we're doing. And we want people to come to Las Vegas to see how this is done. We want this to spread all over the world. We need to make our country healthier. We need to make our communities healthier. We need to address the real problems that are there. This is not about politics. This is about human beings. This is about families. This is about doing what is right. And we as physicians always advocating for our patients. This is what you get.
What you see is what you get.
What you see is what you get, and we're really excited to be here. And if there's no questions.
You got to go to work.
Do you have any questions?
We got work to do.
Do we? Oh, I have one. So,
yeah, go ahead.
So maybe everybody, just if you have something coming up.
Oh, yes.
A way for people at Roseman to get involved in what you're doing. Maybe we just real quickly say that so that the people who are viewing it know how they can get involved. There's a lot, we told them a lot of exciting things this evening, but maybe they want to get involved. And so how could they get involved?
Well, one thing I'd like to talk about is the contest we're going to have for the wrapping of the cars.
Yeah, so I'll lead it off then. All right, so we are ordering electric vehicles for Genesis, and those vehicles will be wrapped with the art of local artists, and they will engage in a art competition, and we're calling the Apple Art Competition. And we call it Apple Art Competition because we were talking in the office one day about idealism, and the art competition is rooted in putting together a piece of art that demonstrates the world the way you wish it were in a particular social justice issue. And so homelessness, how would you see homelessness addressed in the future? What does that look like from an artistic point of view? And so Apple, we figured, we would offer sort of an example of it. So when we first got here, I wanted to give people ice cream. I don't know if y'all remember that, right? I wanted to give people ice cream when we did outreach events.
Which was not supported by the dental school.
Which was not very supported. And the reason was that, you know, people were like, oh, well, you know, we should be giving them healthy food or whatever. But there's a progression. You can't just get that. That's the ideal thing, right? Is to give them apples, right? But in actuality, they want ice cream right now. And so we have this image of a apple on top of an ice cream cone, and that's sort of the mascot of this art competition, so that people understand sort of how we can marry the practical with the ideal to get to where we want to get to. So that competition is coming up, and we're really excited about what that's going to look like. It's a partnership with the City of Las Vegas Department of Cultural Affairs.
Marin, how important is art and humanities
Very important. I think that there's a number of things, and I was going to mention that when you were talking about STEAM and not STEM, which just warmed my heart, because the arts in themselves are just good things. They help us make meaning of things, and in student wellness, for example, reflective writing is very helpful. Expressing what's going on to make it manifest is a very important thing, but it's also good for other things, right? So it could be something that people who are trained in the arts or have artistic backgrounds, we say that this is where, you know, you're creative. You can think outside of the box. Like, instead of doing something the way it's always been done, like to have free reign to be able to do something, and through those kinds of avenues, that's how innovation can take place, right? So that it has a really important part, like to think creatively in any field, right? But with the STEM, like without the A, you know, it's like it's rote, you know, and you're not, you can solve problems, but not solve problems in given ways, as opposed to making new ways, or even saying that's really not the problem. What the problem really is something else. So.
And with this background and the papers on reflection and narratives, it becomes vitally important, because in the future workforce, one of the things that we want to do is also our future change agents. And if a professional or anybody cannot stand up and tell a story, you cannot make change. And not only that, when you tell stories, it also brings a divided nation together. It lets people talk and discuss.
You see people's humanity.
Right.
Or from their point of view, because the thing about the humanities versus the sciences, let's say, is one of the things that we are as humanists is, and you know, in gold humanism as well. When gold humanism got their new slogan, the way I describe it's a humanity is at the heart of healthcare, right? Like, or the human even at the heart of healthcare. And I say it's the radical idea that not just patients, but providers are human beings. You know, and we've noticed with what's been going on for the past, 18 months, this, you know, around the world, that the humanity of the providers has been, you know, stretched to its limits, and that the terrible stories that one hears, and I'm not saying art's going to solve that, but it can get one through. And also we can, the creativity that kind of mindset allows for, might be able to find new ways of dealing with systems and not just having the same old system.
You're an artist, a musician.
A little bit.
Extremely.
I was.
And how important was that in your career?
Oh, it was very important in my career. And I think that certainly during the time that I was in medical school and residency, it was really important for me to have rehearsals, to be performing. That was a lot of fun.
Well, some of us
a nice contrast.
Were just getting an MD. She was getting an MD, a PhD, and being a classical musician. I used to listen to a lot of rock and roll.
I also used to listen to a lot of rock and roll.
Listening is your instrument.
Yes.
We had a band when I was 13, 14 years old, but it didn't go anywhere.
An espresso for anybody who can name that band.
Oh, see, that's another trivia question that you know.
That's Joe trivia right there. You
Joe
got me on
trivia.
that.
And who else was in the band?
Famous Cuban actor
Just give us the name of the
Steve
band.
Bauer.
From
Give us the name of the
Scarface.
band.
Well, he was also in the series, what was that? It was a Showtime series.
Sopranos.
No. The one with
Live.
you used to watch it all the time. The
Okay, give us
serial
the name of the
killer,
band.
the serial killer
Give
guy.
us the name of the band.
No, it's a different one, but it's
Dexter, yeah.
it's The Sportsman.
The Sportsman.
The Sportsman.
You guys, it was 1968, okay?
I wasn't born. No,
That-
I'm just playing.
That was it. And with that, if there's no questions, I'd like to tell everybody thank you for offering us this opportunity to be here. Not just this evening, I mean in Las Vegas, and doing what we're doing. But from Studio A in Las Vegas, this is Cuba Pete, No Laughing Matter, saying thank you. Let's make Las Vegas healthier.
They call me Cuba Pete. I'm the king of the rumba beat. When I play the maracas, I go chick, chiggy, boom, chick, chiggy, boom.